Hello friends and colleagues, I'm Stanislav Chernonog, the author and creator of the School of Vector Massage and Somatics, and today we will talk about the topic of dimples on the buttocks. In fact, dimples on the buttocks may indicate severe and unpleasant conditions for patients with these symptoms. First, if there are no dimples, then this may indicate trouble. If the dimples are asymmetrical, that is, one is deep and the other is superficial, or if they are located at different levels, this will also indicate trouble. And in some cases, when they are the same and deep, this can also indicate ill health. In addition, there are dimples on the tops of the buttocks and there are dimples on the base of the buttocks. Dimples on the base of the buttocks are definitely evidence of trouble, and we will talk about them at the very end of this video. Stay tuned to find out this extremely important information. In order to understand the causes of the appearance of dimples, let's look at the skeleton and the anatomy. We need to look at the anatomy of the pelvic region. Our pelvic region consists of the bones of the pelvis and sacrum. The lowest part of the pelvic region is the sciatic bone, what you are sitting on. And the uppermost part of the sacrum is the place that transfers the load from the sacral spine to the rest of the back. The ligament we are talking about, the sacral tubercle ligament, connects your legs and spine. Accordingly, the following situations may occur. First, the ligament may be inflamed. This will lead to the fact that the edema around this ligament will be detected along the way. Thus, the places on the tops of the iliac bones, at the places where they connect with the sacrum, somewhere here, there will be a place of swelling. This place of swelling will be painful in this case. Swelling in the region at a distance of about a palm, half a palm from the middle of the line, will indicate that there is an inflammatory process along the sacral tubercle ligament. Soreness in this region will indicate that it needs to be worked with. In order to work with this swelling, it needs to be massaged. How should it be massaged? Along the passage of the ligament from top to bottom, or from bottom to top, or you can reciprocate up and down. The second thing that may be associated with sacral tubercle ligaments may be their asymmetric tension. In this case, in one place the dimple will be deep, in another place it will be practically absent. In the case when we have a deep dimple, we need to stretch it in every possible way. That is, we move parallel from the sciatic bone. This, once again, is a dense bone on which you sit upon when you are sitting down. Along the median line, you shift towards the upper dimple. And in the case when we have an insufficiently deep dimple, we look at whether there is swelling on it. If there is swelling, we look at the first item, and if there is no swelling, then we work with the surrounding tissues. First, it is the square muscle of the lower back and the extensor muscles of the lower back. What is located in the lower back above the pelvis along the spine? In the muscles of the lower back of the thigh. We also work on them. If they are tense, then we relax them. And finally, the last situation. When dimples exist and they are deep enough, the problems here may be due to the fact that the skin grows to the sacral tubercle ligament. In this case, this will lead to the fact that mobility in the pelvic region will be significantly limited, and this in turn can lead to problems in the lower back. How we work with this case then? First, we can fix the dimple with our hand and ask the person to bend the leg at the knee. We bend the leg at the knee, and this will give us a feeling of energy transfer from the bending knees to the sacral tubercle ligament. The fact is that the muscles that bend the knee go just into sacral tubercle ligament. Thus, when we bend the knee, we give a little load to the knee flexion. We pull the sacral tubercle ligament, and fixing the skin at the place of its final attachment along the sacrum, we separate the skin from the ligament. The second thing that we can implement is actually pinching the skin on the sacrum and around the sacrum. This is generally an extremely useful practice when working with the sacrum. Feel free to pinch your patient's sacrum, especially if you are properly understood. And finally, the third technique. When you take and begin to very superficially shift the skin in the dimple area up, down, in, and out. The priority direction for us is movement up and down, but movement in and out is also mandatory. If it goes tight, if it is not carried out very easily, then it is worth paying special attention. It is a very common situation when the skin and the sacroiliac ligament have fused together. This will lead to a significant restriction of movement when leaning forward. In addition, it will not allow people to bend backwards. The most unpleasant situation is when the cross-mountain ligament is mobile on the one hand, and on the other hand, it has stuck and grown. This will lead to the fact that a person will have high mobility of the lower back on the one hand and will have practically no mobility on the other hand. This will lead to a change in the length of the legs because the pelvis will be distorted. This will lead to a curvature of the spine in the lumbar spine. This will lead to internal organs shifting. This will lead to metabolic disorders and God knows what else. This is a very unpleasant situation. Therefore, the sacral tubercle ligament must necessarily be released from the surrounding space, primarily from the skin. And finally, the last one. The sacral tubercle ligament has two terminal attachments. First, on the upper part of the sacrum, and second, on the sciatic bone. Quite often, women care about it much more than men, but it happens to men too. Exactly in the middle of the buttock, there's a large hole. A hole on the left and a hole on the right. It can look unbalanced, and moreover, it is still harmful. In this sense, you need to repeat all the same procedures that concern the upper dimples and do them with the lower dimples. You need to fix the lower dimple, work with flexion and extension of the knee, move the skin on the buttock relative to the sacral tubercle ligament, and it is possible to grab the place of sticking and deepening and lift it a little above the surrounding space. Pay special attention to these places if they are painful. My name is Stanislav Chernonog, the author and creator of the School of Vector Massage and Somatics, the school where we teach you to do massage and talk about complex, difficult things in a simple and accessible language. Don't forget to like and subscribe and share with your friends and loved ones. That's it for today, friends. Until next time, take care.